What is the main difference between joint replacement and the LRTI procedure?
I've been doing LRTI suspension plasty for the last 15, 17 years with pretty good results. I believe that the main difference between the LRTI and the joint replacement is the preservation of the trapezium. We don't have to take the whole bone out and burn bridges and remove a whole bone in a joint. I find in my experience the hemiarthroplasty recovers faster and gives better function and motion.
Who are good candidates for thumb joint replacement?
I base my surgical decisions in the level of arthritis, the severity of arthritis. The hemiarthroplasty is indicated for stages 2 and 3 of the Eaton-Littler classification. If I see that there's a lot of deformity of the trapezium or we have arthritis of the STT joint, then I would have to move to an LRTI procedure. So in other words, the hemiarthroplasty is indicated in stages 2 and 3.
How do you set expectations for your patients prior to surgery?
Well, I'll tell the patients that after a period of immobilization of a month, they're going to start progressively to go back to normal activities of daily living. I tell the patient also that there could be some residual pain that can extend in time, and that most of the time goes away with time. And also tell the patients that they would be progressing to more heavier activities in about 6 to 8 weeks postoperatively.
What happens if there are complications with the procedure?
Well, any surgeries can have complications. I think that if we have any complication, either if we can address the complication and save the surgery, continue with the procedure, or otherwise we can transition to an LRTI. And that's one of the main points of these prosthesis. We can transition or switch to the LRTI, which is the classic surgery for this condition.
What are the important design aspects of the Biopro Modular Thumb Implant?
To me, one of the most important aspects is the modularity of the prosthesis. There is 48 configurations that we can use to fit any size of patients. The other important aspect, I think, is the ulnar deviation of the stem of the prosthesis. That gives a unique stability to the components. Yet those aspects of the design makes this implant, the Biopro implant, different to previous designs.
What is your post-op protocol for the Biopro Modular Thumb Implant?
After surgery, I place the patient in a thumb spica splint for 6 to 7 days. When they come back in the first day post-op, I transition them to a custom-made brace, thumb spica brace, and I keep them immobilized for about 3 more weeks. And I emphasize during this time not to use the hand that much and keep the thumb immobilized. In about a month after the surgery, we transition that immobilization to a soft brace. We start hand therapy to increase motion. And in about 6 to 8 weeks post-op, I let the patient to start performing more activities that involve gripping or pinching.
What is the main benefit of the Biopro Modular Thumb Implant?
I think overall the prosthesis is a great option for stage 2 and stage 3. In the past, when a patient comes with a stage 2, stage 3 arthritis, I was tending to leave the patient or prolong the conservative treatment and not go to an LRTI. The Biopro prosthesis give me an option to treat this patient surgically when pain cannot be controlled by conservative measures.